This is the quite new to arthroscopic surgery. This is the only arthroscopic laser in the state. It's really very nice for certain activities such as this. So it's called a free beam YAG holmium laser, which means the laser does not have to be in contact with it, and it's the advantages over using a chisel or an osteotome is that it coagulates the bone and nerves. And you don't have as much pain or as much bleeding post-operatively. And for the surgeon, you can sculpt much more smoothly. This is in the number 6 setting, the 80-watt maximum setting. And you can see to trim this, I don't even have to get very, very close. So we're doing an chondroplasty of the femur. And I must say, I think the laser is superior to the burr in this case. You had a sigmoid notch, I think, an S-shaped notch, and we're changing that into a more proper shape to decrease the risk of further damage to this partially damaged ACL. You see how nicely it sculpts. And using the laser, my experience has been there will be far fewer adhesions than if I used a burr or a chisel or osteotome in here. Normally, I would not come back in here with a shaver or something as aggressive as that, resecting the soft tissue, because I'd be afraid of damage to the ACL. And we're on the number 3 setting. It's really nice for soft tissue work. I certainly sense I can begin to see the origin of this ACL better now. Instead of bleeding, the tissue just vaporizes. You see how small the probe is, and it allows it to go into tight spots like this much better. Now, usually when I use a chisel on this, I never get a smooth border. And I don't get the kind of resection up in this corner that I want. But here I have the definite feeling that I can sculpt and contour this. Oops. A little knob right there I'd overlooked. Just mow it down. Still using the original laser tip I've used for the entire case. It's another nice use for the laser at the end here. Normally if you stick a shaver or a burr in here, the vacuum of the instrument sucks the graft into the resection. Now I want to demonstrate one of the advantages of the and a laser, and that is when you're doing the distal clavicle, is you start getting this tissue at the anterior part of the clavicle. Clavicle's in the middle of our picture, and we're dissolving the tissue to the anterior part of the clavicle without bleeding. This is very difficult to do with the standard Bovie technique or the shaver because it bleeds so badly. The vessels retract, in my experience, right in here, and you can't find them. So I'd say that little maneuver right there just saved me 20 minutes and is going to increase the quality of my visualization. Let's continue here to shave this tissue off the distal clavicle. These are the ligaments of the AC joint, and they're just melting just as we look at it real time. And that is hard to get. I'd say my burr would take that edge off quicker, but then I'd have bleeding. I'd have to bring in the cautery, and then I'd have to bring in the shaver to get the soft tissue charred by the cautery and flopping in the way. So there's a net time saving.
Recent technological advances in less invasive surgical procedures have led to new interest in the use of lasers for spinal surgery. Now, for the first time, Trimedyne's Omnipulse holmium laser provides orthopedic and neurosurgeons with the opportunity to perform percutaneous disc decompression faster and easier with reduced trauma and fewer complications. Dr. Richard Richley, clinical instructor at the University of California, San Diego, has performed more than 60 percutaneous laser disc decompressions using the holmium laser.
As a member of the laser committee at our hospital, I've reviewed all the wavelengths and found that the only one that I felt was safe and appropriate for orthopedic application was the holmium wavelength.
Holmium, element number 67 on the periodic chart, is a trivalent metallic element of the rare earth group. Its wavelength, at 2.1 microns, is highly absorbed in water, the primary component of most tissue. Of all the practical infrared lasers available with effective delivery systems, the holmium wavelength has the highest absorption in water, making it the most precise wavelength for laser disc decompression and offering the most benefits. Since both the ND-YAG and the KTP lasers have low absorption in water and deep disc tissue penetration, these wavelengths may be considered inappropriate for disc decompression.
It's not going to be absorbed deeper than your application, and you don't have to worry about deep tissue damage. It's also a pulsed laser so that there's much less heat, much less charring, and charring is a concern, especially in joints where we see a reaction to a lot of charring.
The Omnipulse holmium laser is considered cold because its heat dissipates quickly. Tissues struck with the beam relax in 1/7 of a second, 800 times longer than the beam's pulse duration. This allows ablation of tissue faster and more precisely than with other fiber optic lasers. To illustrate the simplicity and precision of percutaneous holmium laser disc decompression with the Omnipulse holmium laser, Dr. Richley performs the procedure on a patient with left leg sciatica and a positive MRI scan at the L4, L5 level.
I do the patient in a decubitus position on their side on a mechanical table that I can control the position of their spine. It's very important in getting good placement of the laser needle.
Once the patient is positioned, either prone or decubitus, and draped, Dr. Richley uses the C-arm to locate the level of the herniated lumbar disc and marks the skin. He then measures and marks 8 centimeters from the midline on the patient's symptomatic side. Generally, the angle of introduction is about 35 to 45 degrees. The skin is anesthetized and a small incision is made. Dr. Richley anesthetizes to the deeper level of the annulus with a blunted needle. After the introducing needle is correctly placed, Dr. Richley inserts the holmium laser fiber into the needle. The small diameters of Trimedyne straight fire and side fire laser needles allow surgeons to ablate nucleotic material with minimal trauma. In this case, the laser parameters are set at 1.3 joules per pulse and 10 pulses per second. Dr. Richley will continue to lase until he has delivered 1,200 to 2,000 joules of energy in the disc space. To accomplish safe and effective ablation, Trimedyne offers surgeons 2 types of laser needles, the straight fire and the side fire.
This is a straight metal fiber, the tip of which fires straight ahead. So if this is put into a disc, it'll fire straight ahead and create a defect in that path.
The side-fire laser needle is another example of Trimedyne's ability to develop innovative delivery systems. The side-fire uses proprietary energy-reflecting optics to transmit energy at approximately 90 degrees to tissue. This allows the surgeon to easily achieve vaporization in the region of herniation.
Now, if we put that into the disc space and rotate it 360 degrees, we can then get a circular defect in that disc removal. It'll make the removal of our material much more convenient and complete.
During the entire procedure, the patient feels no heat, no pain, and no discomfort. He remains awake and provides continual feedback. Dr. Richard Smith, an orthopedic surgeon in Orlando, Florida, reports that one of the most dramatic aspects of this procedure is that patients often tell him that their leg pains are gone while they are still on the operating table.
The two main things we're doing are decompressing the pressure in that degenerative disc and also shrinking the disc and shrinking the annulus, the ligament around the disc, to try to get the pressure off his nerves. There's pain in the disc space from disc pressure, and there's pain on the nerve from direct pressure. And we're trying to treat both those.
If visualization is desired during the procedure, a spinal endoscope may be introduced intermittently to observe the area of ablated nucleotic tissue. The entire procedure, including needle placement, is often completed in less than 30 minutes. The Omnipulse holmium laser's simplicity and efficiency provide surgeons with a safe, fast, and economical technique.
The risk and factors involved in open procedures versus a percutaneous procedure are much greater. Bleeding quite often is a factor. They require either blood transfusions or blood readiness. Laser procedure requires no blood and no bleeding. There's much less pain involved in a percutaneous procedure. An open procedure is much more painful. There's an incision and a lot of recovery. A percutaneous laser patient is out of the hospital after about an hour postoperatively. Laminectomy procedure requires 3 to 5 days of convalescence and a long course of morbidity. A percutaneous patient can leave the hospital that same day, go back to work, or resume their activities the following day. So it's a great deal of difference in the morbidity and the rapid recovery in the two procedures.
Other methods, such as chymopapane injections, may cause severe side effects, including anaphylaxis. Microsurgical lumbar discectomy and mechanical percutaneous discectomy also present the possibility of undesired complications. Each requires a larger incision, longer procedural time, and extended recovery time, which often involve greater costs to both the doctor and patient. For the patient with a contained herniated disc and clinical disc syndrome of back and leg pain with a positive MRI or myelogram, holmium laser-assisted disc decompression has been shown to be effective in more than 90% of the cases performed. For patients with special circumstances who are unable to accept general anesthesia or blood transfusions or have other limiting conditions, laser disc decompression is a viable new alternative.
One exciting patient who brings out this laser indication is a patient of mine who was going to have open spine surgery and was found to have a severe heart defect and had severe back pain and could not ambulate or recover from his heart surgery. We went on to do a laser procedure on him. He had complete immediate recovery of his back and leg pain, could have his open heart surgery and his open heart rehabilitation immediately. That was very encouraging.
As technology in this field continues to develop, new and expanded procedures for spinal surgery will be possible.
When we can look inside the disc space with good visualization and technique, we could probably expand this procedure to inner body fusions by causing enough debridement to allow the bones to fuse. So I think the laser, along with endoscopic advancements, will improve our techniques.
Trimedyne's straight fire and side fire laser fibers, along with the Omnipulse holmium laser system, represent an important development in this technology. Designed and engineered with the user in mind, the laser is compact, self-contained, and easy to use, and features solid-state operation, advanced coupling to delivery systems, a swiveling menu-driven control panel, air-cooled operation, single-phase electrical service, and high-pulsed energy. Cleared for use in orthopedics, discectomy, peripheral vascular surgery, and general surgery, with other clearances pending, Trimedyne's Omnipulse holmium laser offers value and versatility. And because technology continues to develop, Trimedyne guarantees laser trade-ins and upgrades under its exclusive non-obsolescence policy. Percutaneous holmium laser disc decompression with Trimedyne's side-fire and straight-fire laser needles offers surgeons the least invasive, simplest, and most cost-effective technique for treatment of herniated discs. Faster procedure, faster recuperation, simple technique, local anesthetic, little or no pain, and less risk of complications, infections, abnormal bleeding, or recurrence.
For the surgeons that are going to begin this procedure, I can tell you that the procedure technically is quite easy. It's very simple to learn. The physiology of laser application is very simple to learn. I think that it provides a great new forefront of medicine for patients with back pain.